Well, I think there were two interesting presentations on leukemia. The first is particularly interesting because what it does is take two well-established drugs that have been used for many years, over 30 years, cytarabine and daunorubicin, to treat patients with acute myeloid leukemia. And in this particular study, the question that was asked, and I should say that the innovation here was a liposomal formulation in a particular ratio that was considered to be optimum. And the strategy here was to determine, and this was a subset analysis of a large study, to determine the effect of this formulation on outcome in patients who are older patients with high-risk acute myeloid leukemia who had previously received this formulation. And the results were very encouraging, suggesting that survival was better in those patients who had received the formulation rather than the conventional intravenous administration of cytarabine and daunorubicin. I think that this has implications for, and prospective studies will be needed to address this. This has implications for the treatment of patients with acute myeloid leukemia that have high-risk disease. The other study is also interesting because I was encouraged to see that CAR T cells have now included being directed against the CD22 antigen in acute lymphoblastic leukemia, and not only CD19, and was used in patients whose disease had recurred after CD19 CAR T therapy with some responses. So this is encouraging. The other encouraging aspect is that the cytokine release syndrome was relatively minor. But I would hasten to say that this is very early days, and we need to assess this after considerably more patients have been treated. What this approach implies is that if technically feasible, and I believe it is, it may be possible to have CAR T cell technology that can target both antigens, not only CD19 but also CD22, and it might improve the durability, the impact of that therapy, keeping patients in remission. Just looking at the entire press conference, is that this is a very good example of innovation using technology that builds on established medicine. Medical approaches that have been in place, but with these technological advances, there could be a significant impact. So each of these presentations could have an impact on practice and could be practice changing.